All right. Hi, Keith. Thank you for being willing to do this interview with young professionals of Naples.
Absolutely. Thanks, Sam. I appreciate it. It always is a good opportunity to be able to share what we do here and create more awareness for the clinic.
Absolutely. So, with COVID-19, our health and access to healthcare is something that I think has been on everyone's mind, given what's happened in the nationwide lockdowns, and maybe things are starting to change a little bit, but there's a lot still up in the air, and illness and fatalities. So I think this is a great time to become more aware of medical services available that are really right in our own neighborhoods, as well as, of course, the incredibly important role that healthcare workers play in this world. As you already know, but for maybe some that are not, that don't know who are watching, my name is Sam Spaiser, and I'm the communications director for Young Professionals of Naples. And one of the roles, Keith, that YP Naples serves is to partner with nonprofits such as the Neighborhood Health Clinic, and help bring awareness to them and assist them in whatever capacity that we can serve, and to connect our members with these organizations in order to build a stronger, more charitable and service-oriented community. Okay, now that I've gotten that out of the way, I'm going to turn things over to you a little bit. Why don't you introduce yourself and what organization you're representing today, and your role?
Absolutely. So Keith Maples, I'm the Chief Development Officer of the Neighborhood Health Clinic. I've actually been at the clinic since 2015. I basically oversee all the PR, marketing, fundraising, donor acquisition, donor interaction. I'm out now going to be actually working with the capital campaign, the construction aspects of it, but we also have been working on the capital campaign for the clinic. So basically my group, we put together everything that helps fund the clinic on a daily basis.
Good. I'm going to just interrupt you for one moment. I am not sure if you are recording.
It has recording on the screen.
Oh, it does say that you're recording.
Yep.
Okay, then I think we'll just continue. Good. Yeah. Okay, good. So what exactly is the Neighborhood Health Clinic, and how would you classify it in terms of like what kind of nonprofit it would be?
Yeah, absolutely. So the Neighborhood Health Clinic is unique. So you can look around across the country, and there are federally qualified health clinics across the country. We're not one of those. We're an independent clinic that is funded by private philanthropy. We take no government dollars, and we take care of basically those in need. We're the safety net of the safety net, as we call it. So here at the clinic, we take care of patients that are 19 to 64. They are 200% poverty, which is about $24,000 a year. They are uninsured, and they're working, and they have to work at least 80 hours a month, and they have no insurance. So it's very important to that aspect because they have no insurance, but they're working, so they're doing their part. So we had over 11,000 patient visits actually just last year alone with our patients. We delivered over 27,000 procedures. And we continue to, and even in COVID-19, take care of our patients.
Good. Amazing. Fantastic. So let's, I think, go back a little bit. And I'd like to know a little bit about how the Neighborhood Health Clinic came into existence and what challenges needed to be resolved. From a little bit what I understand, it was a little difficult to get things rolling at the very beginning in terms of resolving challenges with the state government in the early days of the creation of the clinic.
Absolutely. So to give you an idea, it started with Nancy and Dr. Bill Lescheid. And Dr. Lescheid was a internal medicine physician. He's actually dermatology. And Nancy, emergency room nurse. They had been down in Naples for many years, actually since the 70s. They had thought of doing something when they retired. And as they got close to retirement, they had began the legwork of looking at potentially a clinic to help those in need. And when Dr. Lascheid retired, he felt there was a calling that he knew, as he stated, he knew the needs in the community, and he had to respond to it, and he wanted to respond to it. And so in 1999, Nancy and Dr. Lascheid put together the plan, set up a meeting. They had an hour-long meeting. They actually created a list, and I think there were 14 categories of lists of people that they wanted to invite. And they ended up inviting those 14 lists, those main people. They all attended, and that's where it kind of began. So she had started that in February. They opened April 12th of 1999. The big stepping stone for them, when you talk about some of the issues that they had, was sovereign immunity. In the state of Florida, in the 70s and 80s, they did not have sovereign immunity. And sovereign immunity is the ability for physicians and nurses to donate their time and not have to worry about malpractice insurance and not worry about being sued. And that's very important when you have volunteer physicians and nurses, because you're not going to have somebody volunteer and then all of a sudden have to get malpractice insurance to do that. So that actually went on for years. Actually, Nancy and Dr. Lascheid worked on that for about 10 years. And in 1992, they were able to work with local politicians to get that approved in the state of Florida. So it opened the doors for them in 1999 to start the clinic. Day one, 8 patients. They actually had themselves in the building. It was a suite. They actually had the old train depot. And in that, they had one physician that volunteered. He actually was sweeping that day and helping in any way possible. So it was a big step, those 8 patients. After that first day, Nancy and Dr. Lascheid stepped back for a minute and said, wow, what have we got ourselves into? And they thought this was going to be potentially a 3 to 5 year commitment. And I think as they got into it and it became more evident of the need, it became a lifelong focus for them. And, Nancy's here every day. She's never been paid. She's works more hours probably than anybody around. And you look at it today and you realize that those 8 patients on day one, we have over 15,000 patients in our database now. We know in the community through the Hodges study, it was at Johnson School of Business, that there's over 50,000 people that if they were sick could qualify for the clinic just in Collier County. And again, Collier County is very unique. It's the one county, if you look at it, that the health department provides education and they provide some human services. And I say some, I mean by pregnant women, children, and some infectious diseases. Everything else is left up to either your local hospital or private philanthropy like the clinic. And so the other 68, I believe, counties in the state, their health departments provide human services. In Collier County, it was developed that way that most services would be done through private philanthropy. So that's where you get the David Lawrence Center. That's where you get St. Matthew's House, things like that. And that's where the clinic came in. So it's pretty special.
Yeah, right. It was just sort of a certain combination of policies and population that led to this becoming what it was.
Absolutely.
I think I'm getting ahead of myself a little bit, but talking about the early days, if I recall, is it correct that originally, and I think maybe it still is the case, but that the patients were not required to pay anything, but then at some point the patients actually came back and said, hey, our services you're providing are so spectacular that we actually want to have the opportunity to donate something if we would like to?
Yeah, it was actually the patients that came to us in the early days that said they wanted to contribute. They wanted to be a part of it. And so it was constructed that they would do 1 hour's wage. So back then it was 1 hour's wage to come into the clinic and be seen and be treated. Today it's $20 a month. It used to be $20 a visit, but we realized that we're treating so many patients that, again, have 3 to 5 chronic diseases. They could be at the clinic 4 or 5 times a month. And when you're looking at somebody that's making $24,000 a year, to have the ability to spend, $100 a month on visits, it's not realistic when they're worried about putting food on the table, taking care of their family, and doing those necessary things. So then what we've had the luxury of in this past year, we actually had a donor donate half of that in an annual gift. So our patients were actually only having to contribute $10. It's a donation, $10 per month. It's per the 30 days for their visits. And their visits could some visits could be $1,000 if you had to go somewhere retail and do that. So they get all their medications, they get all their services here. If it means if we have a patient that comes in, they need to pick up their medications for the month, they get those. They need to be seen by a physician. Then they need to go have an MRI done or dental. They get all that within their $10 donation because of the luxuries that we've done here, that we've created with the support of the community and our wonderful, generous donors.
Incredible. And just a little bit, I'd like to come back to some of those services, but let's back up a little bit. And so as you know, Keith, I'm a regular volunteer at the clinic. I love it. Despite the fact that the clinic is really a large, impressive building, before I started volunteering, I used to drive by it all the time, never noticed it. So we probably a lot of the viewers that are watching this are local, and so maybe either they want to get involved or they know someone that qualifies. Where is the clinic located?
Yeah, absolutely. So we're actually off of Goodlet Central and 12th. So if you're heading south on Goodlet, you'll actually right before you hit Central on the right-hand side is the neighborhood health clinic. And to get into the neighborhood health clinic, you would turn right onto Central and then right onto 12th, and then you'd come in off of 12th. And what's nice about that is we have originally started with the current space we are, the 2-story building that was initially built here. It was a car wash. They tore it down, then they built this building. We then acquired all the property all the way to Central, which was Auto Europa, and then there were some transmission buildings for cars. We purchased all that, and we're utilizing that space to continue to add those services. And I know we'll talk about that in a little bit, but to add the services necessary that our patients, when they come here, they can come just to the clinic, be treated, be seen, and then be sent home or sent back to work or whatever the case may be, versus in the older years, a patient would come here. If it was an outside service, they had to be referred to an outside service. We would have to set that up. They would have to go there. So they would continually miss extra time at work. And we know our patients that realistically, you or I get sick, we call in sick, we get paid for the day, we move on. Our patients, they miss an hour, 2 hours a day of work. That's definitely affecting their bottom line, which is affecting, again, the roof over their head, the food on their table, and the family's well-being. Right.
So speaking about the building itself, how large a space is the clinic currently? And maybe you can speak a little bit to some of the iterations of that it wasn't always the size that it is, and how the clinic's been able to benefit the patients.
Absolutely. So when they tore the car wash down and they built this building, it all started because they were looking at a larger space, the ability to treat our patients. We actually had a donor step up and say, I don't buy old buildings. I don't renovate old buildings. I buy land and build new buildings. And he actually gave us, him and his wife gave us the check to buy this original piece of land and to build the building. So they bought this land, they tore the car wash down, they built a 2-story building. The 2-story building is about 11,000 square feet. The first floor is all basically clinical. So you have the center of the clinic is the nurse's station, and then from there it feeds out to the exam rooms, and then you had some administrative offices on the outliers. And then the upstairs, initially when I came here, there were a couple offices, they're administrative offices, and then we had an education center. What we have done now is as you see, this boardroom, this is one of the additions. We actually changed the whole basically scope of the upstairs. We made it conference rooms, boardrooms, and administrative offices, knowing that with our additional build, we're going to build an education room and then an education building. So we were able to add that on. So when we have larger meetings, we can have them in our boardroom. Downstairs, we renovated. We actually moved out the waiting room, made it larger, made intake a larger area and bumped that out. And then we added about, thinking about space-wise, I think it was another 8,400 square feet with the addition of radiology, a full radiology suite, a full dental suite, an education room, some administrative offices, a new cafeteria where our physicians, nurses, staff, our volunteers, they all have lunch as well as dinners at times. So we were able to add that. We're currently in the phase 3, as we call it, building of the second floor of that medical specialty building, and it's the Armstrong Medical Specialty Building. The second floor will have cardiology, gynecology, wound care. It'll allow us to expand some of those services. In that, we're also bumping out radiology. So we were very fortunate when we built this. When we built radiology, we had MRI, CT, X-ray. We're adding now all of our mammography to increase women's health. Our average patient is a 47-year-old female. So women's health is very important. That's where gynecology on the second floor of the Armstrong Medical Building is so important. It gives them privacy. It takes care of our patients and gives them all their services necessary. And then we've also formed a relationship with Millennium Physicians Group that they actually volunteer all their time to see our patients, to basically do all the scans with the MRIs, the X-rays, the CT. They read them for us for free. They do all that stuff voluntarily. And then when we're not using the equipment, you'll actually see their name over there. They actually use the equipment for their patients. So it's a win-win. It allows them to utilize our equipment. They're actually leasing the equipment in the space from us. So we're creating some sustainability. So Leslie, our CEO, did a wonderful job of creating some sustainability, a cash flow utilizing Millennium as a partner, but also them helping us with our patients with all the scans. And then we had the ability on the other side of that medical specialty building to add dental. So we added 4 operatories. We have the full dental suite where our patients can come in when they deal with dental issues, because we know dental is a major issue with care. You know, when you have disease in your mouth, it affects the entire body. And it was very important to our dentists that we did that. So actually that was the catalyst that started this campaign to expand, was to add dental. But then we realized that we needed radiology and our specialty services. So we said, you know what, let's all do it. Let's do it all at one rollout. It was a $12.8 million campaign that we're doing. We've raised about 11.3 million of it. We're very close to raising the dollars, as well as building out our space. So it's pretty exciting, Sam.
Yeah. I mean, all of these additions are incredible. And particularly with the dental, I wasn't expecting to see a dental clinic when I first took a tour, and I was really happy that I did, because later as a scribe at the clinic, I found out that I can't tell you how many times, Keith, that a patient would come in and they'd come in for something else, and they'd say, well, I also have this toothache. Then the doctor would look at it and say, I really think you need to get a dental appointment. You might have whatever it is, but it was something that really needed to be taken care of, or they would, that they just needed it.
Absolutely. Yeah, we had a few patients, Sam. I think when we first looked at this, we had one patient that he was continually losing weight, and I mean, he was to the point where we didn't know if he'd make it. They could not figure out through all the lab work, everything, what was wrong, and it took just getting into his mouth and realizing the disease that was in his mouth had been poisoning his body for so long. And once we treated his mouth, it wasn't 6 months later that he was in perfect health, in a sense. He still had his chronic diseases, but he wasn't losing the weight. There weren't those emergency situations where you didn't know if another couple weeks if he was going to make it or not. And it really was eye-opening. And you started looking at that, and it made sense. And now we have the ability to go down and send a patient down to dental or down to radiology or eventually to the second floor to our cardiology suite, and do all those services. Our patients are going to get probably better service and better treatment than you or I get going to the physician.
From what I've seen and participated in as a volunteer, I couldn't agree more that it's kind of mind blowing to see it, that it's all in one building where the patient comes in and they go to see, maybe it's a primary care visit. And then the doctor says, oh, you know what? It's been a little while since we've gotten some labs done on you. Let's go get some labs done. And then they walk 10 feet, over, then they are getting their labs done. And then 5 minutes later, or whatever, 10 minutes later, they come back and now the doctor's reading their labs. If it were you or me, it would take a couple of weeks. I mean, right. and then after that, then they have all their other a lot of their other specialties are right in the same building.
Absolutely.
So I think we talked about this a little bit, but let's just to hit the point home, because this is really important. Naples has a lot of hospitals, doctor's offices. So why specifically does the clinic need to exist? And I think in terms of, let's kind of group that together with the qualifications that someone needs to meet to not only become a patient at the neighborhood health clinic, but which would disqualify them from maybe, say, a state service or some other government service.
Yeah, absolutely. So, looking at our patients, again, when you're talking about 19 to 64, 200% poverty, again, $24,000. At one point, I think if I'm not mistaken, 40% of our patients were 100% poverty, which is like $14,000 a year. Of those, of our patients, 60% are diabetic. Over 60% of them have, again, there's probably 70% have 3 to 5 chronic diseases. So the cost factor is tremendous. So our patients, as they come in, so 19 to 64, 200% poverty, no insurance, working, so they're doing their part. If they were to go to the emergency room, for instance, they go to the emergency room, they have an issue. Most likely they're going to get handed a prescription, and then they'll be handed a referral to go see somebody. So they've now went to the emergency room. They're getting treatment, but they're not getting treatment. They're getting a prescription they can't fill, so they crumple it up and throw it away. They get a referral that they can't go to because they can't afford the referral. So that gets crumpled up and thrown away. So their chronic disease continues. As a patient comes here, they walk in the door, they make their donation to the clinic, they see a physician, they're treated. If they have a medication, we actually go and get their medications for them. So what is very important is we do the maintenance system for their medications. So every month, let's say I come in and every month I have $1,000 in medications. They come in, we get their medications, they're handed their medications, they're talked through through our pharmacists. They share with them how to take the medications, what the purpose is. It's an educational piece. They're given their medications and they leave. The next month, they show up again, they walk in the door, we give them their medications. So they continually get that. So they're maintaining, or hopefully they're getting better, but at least they're maintaining these chronic diseases, and they're getting the needed service,
Right.
the needed care. If they go anywhere else, there's a fee, and most likely they can't afford that fee. Two of our board members help with intake, and they've been doing it for years, and one has done it for, I think, 17 years. And they did a study, and when they did this study, they checked when patients walked in the door. They looked at qualifying, how much money do you make, all these different questions, and it was mind-blowing to see a patient that $800 a month, $600 a month, $1,200 a month. That's all they made, and they had to put food on the table. They were the sole provider. They were in a space with 10 other people because they couldn't afford the luxuries of some of us in the community that have their own home or apartment or condo or whatever the case may be. So it was really impactful to see that study. And that's where we really realized the 100% poverty, some of our patients, and just some of the extreme circumstances. We have patients that live in the woods. Now you say that and people open their eyes and they'll be like, woods? Yeah, they live in the woods. They go to work every day, but they return back into the woods. And you'll see that as the construction has become more evident in Naples. The East Trail, they put a storage facility down the left side of the East Trail. And when they did that, you started seeing people moving.
Oh, gosh.
They lived back in the woods. And so, it's very important that people understand that, again, our patients wouldn't get the care because they can't afford it anywhere else. And if it wasn't for the clinic, they couldn't get the care. During COVID-19, people go, oh, you guys are open. You're not working from home, isn't it? We can't close. We couldn't close. If you or I need a prescription, our physician calls it into CVS, we get a prescription, we go and pick it up, we're good. We are the pharmacy for our patients. So they need their medications every day. So we've been delivering medications to them every day from 9 until noon. We were here initially. Then it's 9 to 3, and then June 1st we'll be here at 9 to 5. But we're delivering those medications every day to our patients because they need them. If we weren't here, they wouldn't get their medications. So it's amazing. There's some great organizations in town. The hospital has been fabulous to us. NCH has been great. Physicians Regional has been great. Lee Memorial, the Lee Health Systems has stepped in at times and helped us. We have wonderful physicians and nurses here in town. We have great partners, with St. Matthew's House and with some of the other nonprofits in the area. We work together. If it's something we can't provide, we refer them to somewhere. It's unique. Again, the community has 600 nonprofits, 300 active, but they all serve a purpose. And, it represents the 11,000 patient visits we had last year. It represents the 200 plus patient visits we have in a week at times. It's evident of the campus when we're finished. The final phase will be the education building, where we'll have a teaching kitchen and healthy lifestyles classes that are larger and more robust, and diabetic classes. And it'll be evident with the 34,000 square feet that we'll have under roof at the time on our campus that there's a huge need. And we're fortunate that we have the 700 volunteers. We're fortunate we have the volunteer physicians and nurses that can come in and see our patients. They're itching to get back here now. We have physicians that are saying we can see patients, but we understand that we still want to protect and do what's necessary and do our part with the holding down COVID and not creating situations where it could rear its head. So we're being very understanding of that, and knowing that once we get to June 1st, we'll start slowly integrating patients and qualifying new patients again. We know there's going to be challenges with work with some of our patients, and we understand that, and we're working with them on that. But it's something that there's nothing like it. I've been in the nonprofit world for 25 years. I worked for St. Jude for 17 years, all the way up the ranks. And coming here in 2015 was probably the best choice I could ever make. This clinic is amazing. The people we help, the smiles, you're making a difference, and that's all it's about.
Oh yeah. I mean, big difference, big difference. And I feel fortunate that I've gotten the opportunity to participate in making maybe hopefully a little bit of that difference.
You do.
I want to talk a little bit about access to doctors. And what I mean is, myself having health insurance, I can't tell you how many times that I've gone, well, I thought I was going to the doctor, but I didn't see the doctor.
Right.
I saw maybe a nurse or a physician's assistant. Is that the case? I'm playing a little bit here. Is that the case at the neighborhood health clinic?
No, absolutely not. I mean, when our patients come here, they go through initially the triage, blood pressure, things like that everybody goes into the doctor's office and gets that done. They then see a physician. It's important for our physicians to see the patient, to understand. We have the medical records, Cerner, which is our electronic medical records. So our patients have all their information in those files, to where once a patient comes in, they may not see the same physician each time, but they get treated for their disease or their need at that time from a physician. Our patients, as they walk through the door, are neighborhood health clinic patients. So for instance, they may see one physician today, and they're told, hey, when you come back in, you may not see this physician, but you'll see somebody in that specialty, if it's a specialty, or if it's a internal medicine, whatever it is, you'll see a physician of that quality and that caliber, but you're a neighborhood health clinic patient. What that does is it allows that physician that's volunteering for that 4 hours that day to walk out the door and not have to go and worry about that patient getting phone calls and everything else like that, because that patient calls us. If we have to refer back to that physician, we can through our means, but the patient knows that they're a neighborhood health clinic patient. They get their treatment here. They see a physician. They see a nurse. I mean, it even goes down to, you go to dental offices and you have a dental hygienist clean your teeth, and you may see a dentist come in and poke around a little bit. Our dentists are doing a lot of that work too. So they're seeing the dentist for a longer period of time for their situations. Radiology, again, how many times can you get scans done and get results pretty quick like they're getting them anywhere else but our clinic? And the lab work, I laugh. You talked about the lab work. It would be like a week or two. They come in, a doctor gets them in their lab. They get their lab done. Within 20 minutes or less, there's 16 different tests. They get that information. So then that physician can read those results and then talk to our pharmacist, make those changes in medications right then and there. So when they leave, they're leaving with the right medication and they're to help them with what they're dealing with. I go to the doctor. I go to get a lab work. It's a week later. I get a phone call. By the time I'm also pulling it up on my phone or wherever, my labs, and they're then wanting me to come in because they want to tell me all my labs are good, because it's just another opportunity. Here, we don't care. There's no money that needs to be done. If you need that lab done, you get it done. If you need an MRI, you go down the hallway now and get your MRI. We had physicians, when I first started, it was funny. There was one physician, and he stopped with a patient, and he said, okay, I'll see you in 6 weeks. And everybody stopped for a minute, and they're like, see you in 6 weeks. And that was the timetable that they could see that patient. If it was a paying office, if it was truly a medical office, that insurance would cover it. And we were like, you can see him tomorrow. It doesn't matter. And he's like, oh, that's right. We don't file insurance. He goes, okay, tomorrow you're going to have to come back. We're going to do this. And it was one of those situations where they were able to test him again to see, how he's fasting, all this stuff. And didn't have to worry about any of the qualification aspects of insurance because we don't deal with insurance. We don't have to file. We don't worry about any of that. We deal with what's under this roof, with what's best for our patient and how we can deliver the care in the best way possible.
Yeah. And I think what's amazing is we talk about lab tests, and for those that are, maybe a little bit more medically minded or science minded, they might be wondering, well, what kind of lab tests are available right on site? Can you speak a little bit to that, Keith?
Yeah, absolutely. So we have, we actually added new equipment. We can do 16 different tests in 20 minutes or less, and it can be the base, and they're all finger pricks. So no vials of blood, they're finger pricks. They're put into several different machines. We have machines that are on the space station, Air Force One, that do all types of testing. And a lot of it has to do with, especially diabetic patients. We're really trying to regulate a lot of their different numbers. And so we can do a lot of that right there within that visit. And, it's vital. We added, I think, a hemoglobin machine that even tests even more within the scope of it. Once we finish the education building, we are going to transition most likely our lab to our old education room, which is probably about 4 times the size. So it'll allow us to even do more. Because we realize that is a major piece in really getting that information to a physician and dealing with what kind of issue they're dealing with. And you can look at sugar levels, you can look at increased PSA, you can look at all these different numbers now with just simple little pricks. And that's important because, again, when I go get my labs done, I have to give about 6 vials of blood and sit there. They're just doing pricks of the fingers, and it's very minuscule amount of blood that they're putting on these into the machines, and they're getting results within, again, 20 minutes or less. Some take 2 minutes. Yeah.
Right. Yeah. It's amazing technology to have right there. Now, what happens if a patient needs a very specialized test that maybe the clinic doesn't have the ability to do that test? What happens then?
Yeah, so this gives us the idea. This talks about the idea now of our specialty services, our outside services. For the longest time, we've worked with LabCorp, and LabCorp actually does a tremendous amount for us. We realize they're in Ohio. They're a wonderful partner, but eventually they may say, what are we doing in Naples? Do we need to change some things? So that's why we've increased our scope within our lab so we can do things without interrupting any services for our patients. But LabCorp has been wonderful. They continue to be wonderful. I hope they are a long-standing partner of ours, but they do a lot of the outside blood work that we need done. We had radiology, this is where we brought radiology in-house. We actually worked with NDIC, which is Naples Diagnostic Imaging, excuse me, and they actually donated over $2.5 million in radiological services to us in a year. And it was all through scans and readings and everything. And this is something that that group had done for us for years. They were bought out and then liquidated. And when that happened, we lost that ability to get those services. So we then had to work with different ones, if it's regional radiology or physicians or some other groups in town, they would donate services. But it went from 75 scans to under to 10 scans. And we didn't have the ability. And so we started seeing a backlog. And we realized at that point, Dr. Lascheid, when he first looked at the clinic, wanted a campus, a medical home. And we said, why not now? Let's speed the process up. Let's speed this plan up and let's put this into play. So what started as a $3 million dental building turned into, a $12.8 million clinic expansion. which is wonderful. Again, we were able to add radiology. We were able to have donors that paid for the radiology equipment. We had one foundation pay for the MRI. They made a gift. They've been making gifts to us since I came in 15. We talked about an MRI. They talked about the potential of paying for an MRI for us, but it would have been, we had applied every year to them for a grant. They didn't want to do a pledge because they were very understanding that they didn't want to put us in a situation where if they didn't have the means, they couldn't pay for it that year, would we be out? So they said, you just apply for it and then we'll continue to give that money. We applied for it. They gave us $200,000. They agreed to give us $200,000 that first year. Received a check for $800,000 to pay for the MRI instead of the $200,000. We had another donor that passed away that left us $1.6 million, the same cost it was for X-ray and CT. So we're able to have everything we have today under roof without a loan, any bill in that sense. We don't owe anybody. There's no mortgage on this property. We own the property, we own the building, we own the equipment, and it's important for that. We look at sustainability for the clinic and the creation of something that continues without interruption. And that's where it's been vital. And that's where this clinic campus model, as we look to complete it in 2021 with the education building, it'll be there and it'll give all the services necessary for our patients without interrupted service, and they will feel better. They'll get better. They'll be able to take care of their family. They'll be able to go to work. They won't have to worry about those things. When I read a study about 3 years ago, and it was very similar to our patients, low income. It said, what percentage of that demographic goes to the emergency room for dental? It was 70%.
Oh my.
70% of patients, 70% of that demographic for an emergency situation they would go to the emergency room for dental work. Well, you wouldn't get dental work. You get a prescription antibiotic and you're sent on your way. That just shows the need. That just shows when we said, oh my gosh, we realized when our physicians and dentists came to us and said, we need a dental clinic. We needed to add that specialty. And again, that campus mentality and campus mindset allows us to have that medical home for our patients.
Right. And in terms of really the neighborhood health clinic striving to be really as complete and all-encompassing as possible, Keith, what are some of the most frequently used or specialties in terms of specialty doctors that maybe someone might not expect the clinic to actually provide that kind of a service?
Oh, absolutely. So one of the big ones, infectious disease, which is hepatitis C. We actually have a relationship with the pharmaceutical companies. Our medications, read on that for just a quick second. Our medications, we dispensed over $6 million retail value in medications last year. Our budget, $74,000. We spent $54,000, so we still had a surplus of $20,000, but we dispensed over $6 million. How do we do that? We work with Direct Relief, Dispensary of Hope, our pharmaceutical companies. We work with so many different avenues to get their meds. You'll watch TV and there'll be the ad, oh, call this number to get your medications for free. It's not that easy. We actually do that for them. So we do patient assistance for medications. We fill out the information, we file for them, we get their medications, we get that all here. So that being said, we're able to deliver those medications, and that's where the hepatitis C came in. We actually have those pharmaceutical companies donating those pills. At one point they're $1,000 a pill. A hepatitis C patient, as they come in and they're treated, if they ever miss one of their pills, if they ever miss one of taking a pill, they start all over again. And most likely it's more damaging and harder to cure. We've cured over 30 hepatitis C patients. We've actually 100% cure rate with our hepatitis C patients. So we deal with a lot of infectious disease. We deal with a lot of gynecology, a lot of women's health in that aspect. Wound care is amazing that you see patients that they don't stop working. They continually work. So if they have an exposed situation on their foot, their leg, their arms, and they continually are working around water, they don't stop working to get better. You or I would be like, okay, we got to figure out how to keep this dry, and we can't do this anymore for at least the next month or whatever to get better. Our patients keep working. So we work with them on giving them the care necessary and delivering that highest quality of care. So they're able to continue working. The dental was a big one. Radiology was huge. Again, when you're dealing with cardiology, when you're dealing with ophthalmology, diabetes, major issue with our patients, major issue with eyes. Diabetes destroys your entire body actually, but it affects your eyes. So it's working with ophthalmologists and building that in. So that type of care, we see more of it. And we're able to deliver that. And so we don't have to. We deal with cancer. We work with Moffitt. We work with NCH with delivering chemotherapy to our patients. We've dealt with transplants before. If we can't do it on our campus, we work with, again, the hospitals. We work with specialty offices where they'll do the work in their office for free, which is amazing. And so eventually will we build out other opportunities within the clinic to do more stuff on campus that we sometimes have to utilize the hospitals? Maybe one day. That was a start with radiology. The lab is going to be another one. Would it be something that to have a on-site surgery center? It could be one day. We want to just continue to deliver those necessary services that our patient doesn't miss time at work and doesn't take away from trying to make an honest wage and an honest living. And, my first time I walked in the clinic, I was in the parking lot. At first I saw Nancy, never met her before, saw her in the parking lot, said hi. As I'm walking in the front door, a patient's leaving. And I'm like, okay, this is weird. Low income, uninsured, sick. She's walking out with a big smile on her face. I'm like, this is strange. So I walk in, I sit in the waiting room, and I'm like, there's like 25 people in the waiting room. Everybody's fine. I mean, you can tell they're not feeling well, but they're upbeat. And after going through that and seeing that, it made sense. And it made sense because our patients have a place to go. There's that hope. There's that understanding that, they're taken care of. They have somewhere to go. When they walk out this door, they know they're going to get the medications they need. They know they're going to get the services they need. They're not going to get run around and sent off in 80 different directions, but they're going to be treated, and they're going to be treated with the most dignity and respect. Our clinic doesn't look like a normal clinic in a sense because it's cleaner, but that's the respect factor. It's cleaner, it's nicer, it's newer, but we want that. We want our patients to walk in here and go, wow, this is where I go to get my medical care. This is amazing. This is something I'm proud of. Not walking in, as Nancy says, when they first started, it was a rundown 3-suite office. It was nasty, rat infested. That's not what you want. That's what people in their minds expect a free clinic to look like. We don't like that. We want our patients to have the highest quality and the best care, the best stuff that they can have. And because you know what? They deserve it. And what they do for others in the community especially, and what they do for the tourism, for the tax dollars, for everything, they are a major part of this community, the major success of Collier County. And they deserve the best.
It's funny, in terms of the wow factor, the first time I walked in, I said, wow, I wish I could get my medical care here. This is amazing. This is incredible. It was just beyond belief what I could have ever expected.
Yeah, we had Sam. We had a donor come in. This donor is a billionaire, and he said, "Wow, I wish I could get my lab work done here." And we're like, "Well, you can't. We understand." And he goes, "It's amazing. I don't get that. I don't get that care." And that just makes you feel good. It makes you feel good because, man, there are people working their tails off, and they deserve the best care. They deserve to get that treatment. You know.
Absolutely. You mentioned a little bit ago, Keith, about the cost. Well, actually, the large savings in the cost of the medications. Can you speak a little bit about a little bit more about the budget of the neighborhood health the clinic, and maybe sort of where some of that other money goes, and a little bit even maybe how it's fundraised.
Absolutely. So, our budget, $2.7 million. We leveraged that budget to deliver about $17 million in services. So at one point we said it's about a 7-to-1 ratio. So every dollar donated is worth $7 in services. Our $2.7 million budget, we have medical supplies. We have, the lights, keeping the lights on, the electricity and all those typical bills. Our largest, one of our largest expenses is our staffing based on, because we get everything donated. We have 13 full-time staff, 7 part-time staff. So of a clinic that has 20 staff, delivers $17 million in services, on a $2.7 million budget, it's pretty remarkable. So I always emphasize that, so you can look at our budget line item and you'll see some of the expenses. It's fundraising and then staffing, just based on, because our doctors are volunteers, our nurses are volunteers. We have so many administrative staff that are volunteers, that we get a lot of services from them without having to pay for anything. And our CEO, Leslie, and I were talking about this last week. I said, what's amazing for us is we're still raising dollars, but it's not imperative to the extent of, it's imperative to raise the dollars. Yes, we have the needs, but it's not imperative like maybe some of those federally qualified clinics that they may be paying 20 physicians to see patients. And if they're all of a sudden they don't have people walking through the door and paying those fees, they're not able to turn around and pay the physicians. Us, we waived the patient fee during COVID, their donation. We waived it. If their $10 donation, we're like, we're not going to accept it right now because we know you're struggling. We know there's 14% unemployment in the country. We know that a lot of our patients probably are limited. Their hours are limited. So we said, no, that's all right. We'll go out. We'll continue fundraising like what I do and what our group does. We do appeal. We did an annual report appeal. We do a summer appeal. We'll do a lapsed donor appeal. We'll do just awareness of the clinic allows people just to make a general donation to the clinic. So we continue to see that. Have we seen a little slump in donations? Absolutely. When you have a stock market get hit in the month of March by 35%, and most people are down about 10 to 15% now, you're seeing a decline. When you see 14% unemployment and people worried about making their rent, or paying their car payment or putting food on the table, they're lessening donating. So yes, we've seen that. Have we seen a huge drop? No. I think we're very fortunate that we have a wonderful and generous donor base, and people know that what we do is necessary, that they're continuing to give. So our $2.7 million budget deliver over $17 million in services. We continue to raise the dollars. We continue to say, if you can, please give. We're always open to accepting gifts. It's very we're very lucky and very blessed.
And it's incredible how generous a lot of people can really be in terms of helping such an amazing cause. Now, this past February, and my understanding is it's every February, there was a large fundraising event. Can you speak a little bit about what that was?
Absolutely. I'll throw a couple of events in there.
Okay, great.
The first event I'll throw in we had last year for the first time, was the neighborhood bash. This year it's November 6th. This event is fun. It's $100. It allows people to come in. We'll have some food trucks. We'll have a local brewer come in for beer. We'll have wine. So we'll have the food trucks, beer and wine, entertainment, and it's held right in the parking lot. We'll have tents, but it works two ways. One is it's $100. It's a good way to support the clinic. It's a good way to see the clinic and see other in the network. But we open the doors. So you can also come into the clinic, see the clinic, tour the clinic, and see really what it's all about. It's a great event. Last year, it was the first year. We were very happy with it. We had a couple hundred people, and we're looking to have more this year. It'll be again in the parking lot. We'll have the tents. The doors will be open to come inside. And then we have an event February. That's February 6th of this coming year, 2021. That's where the bash came from in a sense. It used to be called, it was a fun event like the neighborhood bash. But it's turned into a gourmet vintner dinner. It used to be called the block party. Now it's the gourmet vintner dinner. It's an event that's at the Ritz-Carlton on the beach. We've had it, I think 16 years. Last year it raised $1.1 million. We're very fortunate. It's a nice event where you come in, you have a vintner. You have about 14 vintners. I think last year we had 12 vintners that bring their wine. So you have a reception for an hour of popping around drinking different vintners' wines. The dinner starts at 7. It goes till about 10. And at that time you come in, you have the vintner wine served at table. You have a nice dinner. You have a brief program, and then you have entertainment. And then we have at the end of it, we have an auction. We call it Save a Life, where it's people that can donate to the clinic. And again, that event is a wonderful evening. It raises $1.1 million. Those are our two larger events. We have a guild luncheon that's in March. It's a luncheon. We're looking to do it at Port Royal Club. We had to reschedule it this year because of the pandemic. We were fortunate to get through the Gourmet Vintner Dinner this last year. And then we'll do tours. We call them Evening with a Purpose, but I think we're going to do one in October. And then January, March, and possibly April. They're special evenings. They're receptions here where we'll have beer and wine, water, some hors d'oeuvres. And then it's an opportunity to see the clinic, but then also sit down and hear from the clinic. If it's from our CEO, if it's from our founder, if it's from one of our top physicians, you'll be able to ask questions and learn more about the clinic. So those are some of the things we do that create awareness, but also create revenue for the clinic. And those are outside the appeals, the general donations, and things like that. So, and then we have third parties that raise money for us. If it's Jay McLaughlin that does a sales day for us, if it's some of these private men's groups or private groups that go around and do smaller fundraising and make a donation to the clinic. If it's we have a Women's Republican Federation that did a luncheon that chose us as their charity, that use the dollars to make a sponsorship for the Gourmet Vintner Dinner, and then participate in other ways. So there's several different things that you can do, but we only have a few events because we don't want to be event driven, and we're lucky because if we were event driven right now, we wouldn't be making any money. But it's the communication with our donors and the constant updating of information to let them know kind of what's going on, let them know how they're making an impact. So we continually strive to show that we're good stewards of the dollar that they donate, and that what they believe in, giving them updates on what's being done.
Yeah. And Young Professionals was really excited and happy that for the dinner that we were able to connect the clinic with
Yeah.
with some volunteers to help with that event. So
Absolutely.
we were really happy to be able to help in that way.
Yeah, and that gives me, when you talk about volunteers, that's another opportunity for that event, but also volunteering for the neighborhood bash as well. We'll have stuff going on there, participating with the bash, promoting the bash. Anytime you can share that information with others about events that we do, those are just little steps that make huge differences.
Right. And I think, and starting to wind things down today, what can you speak a little bit about how you talked a little bit earlier, but just to kind of encapsulate it in a small segment here, in terms of how COVID changed what the health clinic was doing, how you were operating, and sort of now how you're starting to ramp things back up.
Yeah, absolutely. So, it was one of those situations. I remember we were back in March, and we started to see some groups canceling events. And it was probably 2 weeks before our luncheon we were supposed to have. And, we said, we're going to keep it on course. The magnitude, we're not sure of the magnitude. Once we realized the magnitude of COVID-19 and the numbers they were talking, we postponed pretty much everything. We looked at it and we said, okay, what do we need to do to continue to take care of our patients? That's where we didn't close down. We made the choice that protective equipment, if it's the mask, the gloves, the eyewear, were all necessary as we saw patients, as we got more information. We then began limiting hours. We then said, okay, we changed during this process how we administer the medications. We administer them in a different process now, not exposing the entire clinic to an individual. Because again, we had to lay out. Nancy was really good about laying out. She did COVID basically protocols every day for about 2 weeks, and those allowed us to look at the way we delivered medicines, taking care of patients, interacted with the public, handled things inside. If it was the way we're cleaning, what we were doing, continuing monitoring the situation. We do a better job, and we've always been clean. We do a better job now of cleaning more. We've done a better job of cleaning out stuff that we haven't used or didn't need. We realized, even seeing patients as we move forward, our physicians and nurses will be in full PPE, the equipment necessary to reduce any chance of exposure of anything. We look at continually making those changes that everybody's making. That how long are we going to wear masks? Is that going to be a necessity? Is it a face shield going to be necessary for all these times now? But we're continually putting those in place and knowing that we'll move that way as long as it's necessary. But I think we've really looked at a lot of the protocols and the processes and really made a lot of changes to protect not only the patient, but the physician, the nurse, the administrator, focusing on everybody's well-being. And if it's, as you walk into places, a plexiglass screen in front now to prevent any exchange of anything that can contaminate. If it's hand sanitizers everywhere, if it's, more of the awareness factor, it was very important of the social distancing. We're going to continue all that stuff, and we have to, because we know that once you take a relaxed approach, you then look at numbers going up. And again, Collier County, the numbers were going down. They increased a little bit, I think, yesterday. So you're going to see that up and down, I think, a little bit more as they start releasing and making things a little less strenuous on people. So we've made a lot of changes, but we put good protocols in place. In fact, we put protocols in place that I think a lot of other places, medical wise, didn't have in place yet. And I give that credit to Nancy, our medical committee, our board, our leadership with Leslie. They really focused on that each day to make sure that we were doing everything necessary to prevent the spread of this disease, as well as protect our patients, staff, physicians, nurses, everybody that's a part.
Yeah. So once again, the neighborhood health clinic is cutting edge.
Yeah, absolutely.
Which is
absolutely. We were sharing those protocols with other physicians, with other groups that they could use it. Again, the beauty of what we do, and we don't mind sharing anything because we want people to benefit from it. I look at the nonprofit world in general. Nonprofit world in general is shared. It's shared information. It's shared different fundraising techniques. It's shared everything that you do, somebody else has done in a different way, but use parts of it to benefit their organization or their organization. So, that's how I look at it. The same thing with us. As we treat as we treat patients medically here, whatever we can do to share that information with others so it helps them in their medical office, in their office in general, do things different and better, so be it. It's always about helping somebody.
Terrific. Yeah, really terrific.
Yeah.
And in closing here, what opportunities are there for young professionals or others, in Naples, Southwest Florida, that would like to get more involved with a neighborhood health clinic?
Absolutely. So, there's always the ability to come to the clinic and volunteer. As you mentioned, as a scribe, bouncing around to different parts of the clinical medical facility downstairs, being able to help in the lab, able to help in development. If it's with a mailer we're doing, if it's an event we're doing, to help volunteer at that event. If it's to put on your own event or put on your own fundraising opportunity to donate to the clinic. If it's setting up, we always look at if it's setting up a small group, almost like a advisory group of young professionals that we could, utilize and brainstorm with about doing other events or helping create awareness in the community. Those are always big. The bash is always big, volunteering there or participating, volunteering or participating with the gourmet vendor dinner. We do mailers. We're going to start doing more stuff in-house that we have the ability to do. We also have a marketing position that's going to be open within the clinic too. So we have a marketing coordinator position that we're looking to fill over the next month or two as well. So if there's somebody that is in the Young Professionals Naples that's looking at a marketing type position, or they know of somebody that's a entry-level marketing coordinator type position, send them our way. We'd love to talk to them and spend a few minutes with them to see how their interest is, to see if it's a good fit.
Yeah, definitely. And it's great to know that there are just so many different ways to get involved and to contribute.
Yeah.
Keith, thank you really so much for your time, sharing this information, this knowledge about the clinic. This has just been wonderful.
I appreciate it, Sam. And again, if anybody has questions, they can always go to the website, which is www.neighborhoodhealthclinic.org. Or they can, of course, stop by at any time. We're here, development offices upstairs. We can share regarding the clinic, give them a tour, things like that. But feel free to pop on the website, see more information about us. And if they have questions, feel free to give us a call.
Excellent. Thank you, Keith.
Thanks, Sam.
Take care.